Good day everyone, my name is Chris Daniel Sumawang, a student nurse from Tarlac State University from BSN 1B, and for today I will be performing a performance checklist about the assisting of the patient with turning in bed. So first thing that we need to know is the goal of our performance. So the goal of our performance is that this activity will take place without injury to our patient and to the nurse itself. So following the nursing process, we will now proceed to our procedure. First thing that we need to do is we need to assemble our equipment. We do need to have a friction reducing sheet or a draw sheet. We also do need to have a bed surface that inflates to aid in turning. We also do need to have a pillow or other supports that may help the patient to maintain the desired position and to also maintain the proper body alignment or correct body alignment of the patient. We also do need to have an additional nurse or a caregiver based on assessment. And we also do need to have a non-sterile gloves and PPE as indicated. So we will now proceed to our implementation. So first thing that we need to do is we need to review the physician's order or the nursing care plan for the patient activity, and we also do need to identify the movement limitation of the patient and the ability of the patient to assist in turning. Next is we need to gather any positioning uh, aids or supports if necessary. So here we will be using pillows as our positioning aids. Next is we will be performing hand hygiene and observe other infection control procedures, and we need to put on PPE as indicated. For our next step, which is our fourth step, we need to introduce ourselves to our patient, and we need to verify the patient's identity, and we also do need to explain the procedure with our patient. So, hi po, my name is Chris Daniel Sumawang, a student nurse from Tarlac State University, and for today po, I will be your student nurse. So, ma'am, may I know your name po? Okay po, and may I see your name tag po? Thank you po. So for today po ay i-assist ko po kayo sa pag-turn po sa inyo pong bed para po ma-achieve nyo po yung proper body alignment nyo po. Okay po? Thank you po. So after that is we will proceed to our fifth step, which is we need to provide some privacy for our patient by closing the curtains around bed or closing the doors to room if possible. We also do need to position at least one nurse on either side of the bed, and after that is we need to put pillows or wedges or any other supports that will help us to in positioning within easy reach. After that is we need to place or we need to adjust the bed in a appropriate or comfortable working height, usually elbow height of nurse. And after that we will be lowering both the side rails of the bed. So assuming that we have already adjusted the bed in a appropriate working height and we have already lowered both the rails of the bed, we will now proceed to our sixth step, which is we need to, if not already in place, we will be placing a friction reducing sheet under the patient. And for our seventh step is we need to use that friction reducing sheet to move the patient on the edge of the bed towards which he or she, opposite to the side, towards which he or she will be turned. Okay. So ma'am, i-move ko lang po kayo sa edge ng bed dito po sa aking side. So, magka-count po ko ng 1, 2, 3. Okay po. 1, 2, 3. Okay, thank you po. So, for our 8th step, which is if the patient is able, we need to have the patient grasp the side rails on the side of the bed towards which he or she will be turned or turning. And alternately, we will be putting the patient's both arms cross across his or her chest and cross his or her far leg over the leg nearest to us. So ma'am, pwede niyo po bang i-cross po yung inyo pong arms? Let's say for example, here, she have already crossed and both his or her legs have already been crossed. And for our 9th step, we will be, if available on the bed, we will be activating the bed mechanism of the bed to inflate the side of the bed behind the patient's back. So for our 10th step, the nurse on the side of the bed towards which the patient is turning should stand opposite to the patient's center with his or her feet spread out at about shoulder width and with his one foot ahead of the other. And after that is we will be tightening or we need to tighten our gluteal and abdominal muscles and flex our knees, and we need to use our leg muscles to do the pulling. And after that, the nurse on the other side of the bed should position his or her hands on the patient's shoulder and the patient's hip on assisting in rolling the patient to the side. And after that, we will be instructing the patient to pull the side rails of the bed at the same time. And after that is we will be using the friction reducing sheet to gently pull the patient over his or her side. So let me go on the other side. So let us assume that the other nurse is on the other side of the bed, and I will be using the friction reducing sheet. So here. Okay ma'am, ito turn ko na po kayo. Now we will be turning the patient on our side. So the patient or the nurse on the other side will help me push the patient towards my side. Okay, ma'am. 1, 2, 3. Okay. Thank you po. And after that, for our next step is we will be putting the pillows on the back of the patient, behind the patient's back. Okay. Is that comfortable po? Okay, thank you po. And for our next step is we will be pulling the shoulder blades of our patient forward and out and from under the patient's back. So ma'am, using ko lang po, shoulder blade. Okay, thank you po. And for our next step, we will be making the patient comfortable and position the patient in a proper body alignment by using pillows and other supports on the patient's legs and arms as needed. So for example, we will be using this pillow and put it on the patient's legs or on the patient's arms. So after that is we will be readjusting the patient's pillow behind the patient's head. And after that, we will also elevate the head of the bed as needed for comfort. So for example, I have already adjusted or elevated the head of the bed. We will now proceed to our next step, which is we will need to lower the bed in the lowest position with the rails up. And after that, we will need to make sure that the call bell and other necessary items are within easy reach. So for example, I have the call bell in my hand. Okay. Ma'am, ito po yung call bell. Kung may kailangan po kayo, alam niyo na po ang gagawin niyo. You just need to press this button para po ma-alert po kami. Okay po? And after that, we will be cleaning transfer we will be cleaning transfer aids as per facility policy, and if not indicated, for single patient use. And after that, we will be removing our gloves and our PPE, and we need to perform hand hygiene. So for our evaluation, the expected outcome is met when the patient is turned and repositioned without injury to the patient or the nurse. And also, the patient demonstrates proper body alignment and verbalizes comfort. And for our documentation, we need to make sure that we need to document the time that the patient's position was changed and the use of supports, and any other pertinent observations such as the skin assessment. And also we need to document the patient's tolerance to position change, and also we need to document as well the use of aids to facilitate the movement. And that would be all for the assessment or the performance of the assisting of the patient with turning in bed. Thank you.